Welcome to the deep dive. Today we're getting into something really important, the state of public health globally. We're looking at advances, sure, but also, frankly, some major challenges. This is all in the context of the Sustainable Development Goals, or SDGs, particularly Goal 3, Good Health and Well-Being.
Yeah.
We've been digging into a critical review of scientific work from the last few years, 2020 to 2024, our mission to really try and understand where things stand, and what needs doing urgently if we want healthy lives for everyone.
Yeah.
Thinking back the COVID-19 pandemic, it really shone a harsh light on the weaknesses in health systems, didn't it?
It absolutely did. A real stress test.
But what's also interesting, I think, is how it forced adaptation, like really rapid adaptation.
Yeah, it pushed innovation in ways we probably wouldn't have seen otherwise, or at least not as quickly.
Showed us we can be agile when faced with these huge, complex problems. It was, well, a definite turning point. Exposed vulnerabilities, but also our potential.
Definitely. And one area that just exploded was digital health.
Right, telemedicine, AI, all that.
Exactly. And look, it wasn't just tech for tech's sake. It genuinely improved care quality in many cases and access, too, especially, for people in rural or more remote areas.
That's a huge plus.
It is, but we have to be honest here. There are still big challenges. Access is still patchy.
So not everyone's benefiting equally.
Not at all. Vulnerable areas often get left behind. And then there are the ethical questions surrounding these technologies. Data privacy, algorithmic bias, things like that. We're still grappling with those. And if we widen the lens a bit beyond digital, it's a complicated landscape. We're actually seeing a comeback of some infectious diseases.
Oh, what?
Things like dengue fever and even rarer stuff like Guillain-Barré syndrome popping up in places.
Wow. So that means...
It means our surveillance systems, our ability to spot and respond to outbreaks quickly, they really need strengthening everywhere.
And then there's the other side of the coin, the noncommunicable diseases, NCDs.
Ah, yes, the slower, quieter pandemic in a way.
Heart disease, cancer, diabetes. The numbers are just staggering. They account for, 74% of all deaths globally?
That's right, 74%. And the burden falls heaviest on low and middle income countries.
It really points to a massive challenge in prevention, doesn't it? Not just treatment after the fact.
Precisely. It's a systemic issue. And tied into all this, inevitably, is mental health, another critical area.
Which the pandemic definitely didn't help.
Not at all. It's significantly worsened anxiety and depression worldwide. We saw figures like 50% of Peruvians reporting a significant increase.
50%? That's huge.
It is, and yet the resources dedicated to mental health are often tiny.
Like the Peru example, only 2% of the health budget.
Exactly. And globally, estimates suggest 60% of people with serious mental health conditions don't get the care they need. That gap is just profound.
And these gaps, these inequalities, you see them everywhere you look. It's quite sobering, actually. The sources point out things like infant mortality in rural areas being, say, 3 times higher than in cities in places like Peru.
Stark differences.
And marginalized groups, indigenous communities, Afro-descendant populations, facing maybe 40% lower access to even basic health services.
These aren't just numbers on a page. It's about people's fundamental chance at a healthy life being unequal from the start. Something that's really gaining traction, and I think is vital, is this idea of planetary health.
Okay, explain that a bit more.
It's about recognizing the deep interconnection between human health, animal health, and the health of our ecosystems. They're not separate issues.
Right, like climate change affecting health.
Directly. It's increasing respiratory problems. It's changing patterns of infectious diseases like dengue and malaria because the vectors, the mosquitoes, are moving.
So it's not some abstract future threat.
Not at all. The WHO estimates it could cause around 250,000 extra deaths per year between 2030 and 2050 just from climate impacts alone. It forces us to think bigger.
Okay, so putting this all together, it's a lot. We've also got this silent crisis of antimicrobial resistance, right? AMR.
Yes, a huge looming threat. Around 700,000 deaths globally each year already attributed to it.
700,000.
And rising.
Rising. One source mentioned a 40% increase in resistant infections in Peru, for example. It threatens modern medicine as we know it.
Scary stuff. But it's not all doom and gloom. There are positive steps being taken.
Thankfully, yes. The sources do highlight innovative efforts, like Peru's healthy food law.
The one with the warning labels on processed foods.
That's the one. Simple, clear information for consumers. It's about changing norms, empowering people, or things like establishing community mental health centers, getting care closer to where people live. These show concrete ways forward.
So today's deep dive, it really paints a picture of public health that's kind of paradoxical, wouldn't you say?
How so?
Well, on one hand, we see amazing progress driven by innovation, new technologies, but on the other, these huge, persistent, complex challenges remain.
That seems fair. Progress and problems, side by side.
And it underlines just how much we need, well, urgent action and real global cooperation. Absolutely. And perhaps that leads to a question for you, for everyone listening, thinking about that planetary health idea we mentioned, or sometimes it's called One Health, this integration of human, animal, and environmental well-being. How might really embracing that approach change how we prioritize health solutions? How could it help us build genuine health equity right there in your own community? Something to think about.